And we've started recording. Okay, good morning, everyone. Hello and welcome to the March 2020 Fresh School Health and Nutrition webinar. I am your host, Salome Asris, coming from my home, sorry, from Save the Children. Just a quick brief introduction about Fresh. For those who are new, FRESH is an interagency partnership for school health and development in low and middle income contexts. As a community of researchers, practitioners, and policymakers in education and health, we host webinars monthly on topics related to children's health and well-being. This month, we are commemorating World Water Day, which has always been celebrated on March 22nd since 1993, to celebrate the vital importance of water and to raise awareness for the nearly 785 billion people living without access to safe water worldwide. The theme this year is water and climate change, which aims to highlight how inextricably linked these two are, and how by recognizing water's impact on the climate and climate change and adapting, we can project our own health globally as well as save lives. One of the key messages this year is emphasizing how water can help fight climate change through sustainable, affordable, and scalable water and sanitation solutions. In light of the current COVID-19 pandemic, and in commemorating this important day, we are focusing this webinar around the importance of WASH work in schools. We will learn today about practical technical and management tools around group hand washing, as well as how to navigate the balance between hardware and software interventions in WASH work. Now to introduce our speakers. Our first speaker is Bella Monze, and she is the Senior Advisor for the Fit for School program at GIZ, and supports ministries in education develop, implement, and scale up effective school health and WASH and school programs in Southeast Asia. Trained traditionally as a dentist, practicing for 10 years in private practice and working together with insurance systems in Germany, she works to improve oral health in schools. At Susanna Network, she co-leads the WASH and Institutions Working Group and has been involved in recent years in the global advocacy towards harmonizing strategies towards, targeting the SDGs for WASH in schools. She holds a PhD in global oral health from Radboud University of Nijmegen in the Netherlands. Welcome, Bella. Our second speaker is Eric Stowe, and he is the founder and CEO of Splash, a nonprofit organization that focuses on bringing safe water, sanitation, and hygiene programs to over 600,000 children living in urban poverty across Africa and Asia every day. Splash's work focuses extensively on bringing resources of public, private, and social sectors together to create scaled and lasting models of WASH success across some of the world's largest and poorest cities. Since 2007, Mr. So has spearheaded this new model for international development, and his work has been cited in several publications, including the Stanford Social Innovation Review, Forbes, CS Monitor, Wired, and many more. Welcome to both our speakers. Just quickly before we get into the presentation, just a gentle reminder to our listeners to keep yourselves muted if you are not already throughout the presentation. If you have any questions, please put them into the chat box, which I will be monitoring, and after the presentations, we'll have a quick Q&A session, which I'll pull questions from the chat box as well as from the general audience. Thanks so much for your time, and Bella, over to you. Just let me know when you'd like me to advance the slides.
Okay. Can you hear me? Yes. Okay, yeah. Thank you very much for the very friendly introduction. Yes, I'm working for the Fit for School program. I'm based in Manila, and with half of my time based in Germany within GIZ to work on WASH in schools within the company. Okay, next slide, please. I will briefly talk with you about WASH in schools in the SDGs, about group hand washing as a concept and the context, basic principles of group hand washing, experiences from the Fit for School program, and introduce to you as well the UNICEF GIZ compendium of group hand washing facilities. Next slide, please. What you can see here is an infographic of the Fit for School program. And you can see you have interventions in the middle, and we surrounded the hand washing intervention, and you have infrastructure where you can see what you need to to execute certain interventions. And of course, you have the stakeholders on top there. And you see as well on the left side, you can see the entire topic of school management, which includes monitoring, routine, planning and budgeting, and stakeholder involvement. All that is needed in order to execute certain interventions. Interventions will never just work in isolation, and also infrastructure will not function without interventions and also without stakeholder and school-based management. Today we look at hand washing and infrastructure, specifically on group hand washing facilities. Next slide. As you all know, we have the SDG targets for washing schools, and we have 3 thematic areas: drinking water, sanitation, hygiene. And what we all try to reach are basic service level, and for hygiene, that means access to hand washing facilities which have water and soap available. And that should be available for all schools around the world. And of course, within each school, each child should have access to that. Next slide. As you can see, the baseline results from the JMP, they were conducted in 2016. And you can see that for access to drinking water, sanitation, and hygiene, hygiene has the lowest figures to achieve the basic service level. So it's the weakest of all thematic areas within water, sanitation, hygiene for schools. And specifically in times like now, we really, really need to look at this. Next slide, please. What we can see in most schools are here and there hand washing facilities. And even with the current SDG target, or the basic service level is reached if we have a functional hand washing facility in school, because that's very, very basic what we can reach there. But in order to make possible that all children can really wash their hands prior to eating, and specifically after using the toilet, but also now many schools do, many countries start to request hand washing prior to children entering the school ground. You need something different than just one hand washing facility, because that will never ever make it really possible that children will wash their hands in school. Next slide. Yeah, the challenge is all schools by 2030 should have hand washing facilities with water and soap, facilities which can accommodate hygiene activity as many children at the same time in an efficient and effective way. They're really needed. An emerging need for group hand washing facilities which can accelerate scale up hygiene activities. Next slide. Yeah. You might all remember the SARS and H1N1 situation which hit Asia 2005-2006, and we were at that time, we were working in the Philippines, and the Department of Education of the Philippines released a department order mandating all schools to provide hand washing facilities and practice hand washing every day at school. And you can see very simple facilities there with just tippy tap with bottles, and also other facilities with tubs. And you could see schools were starting building group hand washing facilities on their own. Very different types of hand washing facilities, from very, very low cost up to quite expensive. And different experiences were made with the different sort of hand washing facilities. And you can see here, the most simple one is the tippy tap, which nearly each school can set up in a very, very short time. Next slide. But when looking at the hand-washing facilities, we could also see that common problems were occurring. So taps easily get broken or very often stolen. The school will have problems with high water consumption. Very often water is unavailable, or there is insufficient water pressure to accommodate for longer facilities. So the first facilities will still work, but the ones more at the end of a group hand washing, self-instructed group hand washing facility might already not work anymore. Very often with quite low quality of construction, short service life of material sometimes, and also in many areas we had also unavailability of skilled labor to construct group hand washing facilities, also in very remote areas. Next slide. And so there was a long discussion to really start on work for standardized group hand washing facilities, which are more durable and which assure functionality, which would be independent from piped water supply, which would have low cost due to low cost construction and operation and maintenance, because there is more bulk built and higher numbers, which minimize water consumption and allows for really community involvement, and if possibly can be prefabricated and perhaps even also local production. Next slide. What you can see here is a concept on group hand washing facility and what it takes, which is based on the 3-star approach, and where the 3-star approach is a concept how schools can move from very low situation up to reach national standard, to really work on a concept, not having just one possibility and one option, and which is already very sophisticated, but work on something the school can afford and enabling schools to do first steps. So it's based on the 3-star approach, which means on one hand, for hardware, you have to have an idea of the facility number and size. You need to have need to know what you can afford, the material and the design, water supply, soap and other consumables on the hardware side. And on the other end, you have software and management input, which means that WASH needs to be managed in the school as part of the school improvement plan to really build up facilities, schedule of daily activities, supply, that is sustainable supply of consumables and soap, schedule for operation maintenance, and monitoring, evaluation concepts and tools so that you can measure progress and know where you are. Next slide. And again, I will now speak a bit more about really only this hand washing and facility aspect. Next slide. And if you see here this, well, for the 3-star approach, this is the catalog, which you can see on the left side. And the catalog takes many different hand washing facilities around the globe, which have been collected by GZ and UNICEF to really help schools and countries and ministries of education to learn from each other. It's sort of an exchange of knowledge and collects a lot of experience and different sorts, from very low cost, as you can see here on the top, up to quite sophisticated facilities. Next slide. The catalog takes, as you can see here, sketches of different facilities. Next slide. And also an overview in a very structured way for each and every facility. You will see the advantage, the disadvantage, or the limitations, recommendations, usability aspects, as well as all specifics of the design. Next slide. Can you go for the next slide? Yes. and also in much detail the cost of each facility. So with a bill of quantity and exactly the price, what it takes to build that. Next slide. And here you can see facilities. There's something in Indonesia, quite sophisticated. Then the next slide, please. Here you see something, an example from Afghanistan. Next slide, please. Then you see an example. This is in Lao PDR, where they have very long group handwashing facilities. No, this is Cambodia, sorry. This is Cambodia because Cambodia has bigger schools. Lao has very small schools. Next slide, please. Yeah. This is a facility in the Philippines. You can see the basin, and you see the facility is, or the washing facility is the blue pipe, which you can see, which goes all around. And this will accommodate, I think this can accommodate up to 50 kids or even more, yes. So they have the possibility to really all wash their hands. Next slide, please. What you can also see is a change from you have no tap here. You can see we have little holes in the pipe. So there is the amount of water coming out is limited, but it's also a request that the children will all wet the hand at the same time. Then the pipe has to be, somebody has to turn off. Then children will all take the soap, lather their hands, and then it will be washed off again. So it needs, these facilities will only be possible within a very organized hand washing as a group activity. Next slide. A lot of things were built on school level, but we also saw advantage and disadvantage. And it's also something, of course, you will not immediately in a given country be able to do prefabrication. But if group hand washing is really started, then perhaps it's good to really start with activities on school ground so that schools start to do something. But when the ministry gets ready, it's also good to look for prefabricated solutions, because that is really helping to prevent reinventing the wheel and making use of all the learnings gathered in many different places in a given country. And a prefabricated facility ensures quality and efficiency for local production in a centralized place. And you can also look for quality control, and it can be safely produced and distributed to respective schools. Next slide. And here you can see the wash-a-lot. That's an invention which was done within the Fit for School program. There were many different wash-a-lots. There is also a presentation available about the generations of wash-a-lot. This is the third generation, started in 2017, and you can see it's built of HDP pipe with 10 individual stainless steel water outlets, which have been produced, which come from the agriculture sector. They're normally used for as drinking water outlets for animals. So when you touch them, water comes out. But you have also to learn that the water flow is much slower. So you have a very, very reduced water consumption. Next slide. This is a wash-a-lot, and you can see how the soap is being fixed there, so that soap is always available, and there are clear instructions for cleaning and maintenance. So you can also see this wash-a-lot is not connected, can be connected to a water pipe, but will also work without a water pipe. So it can be filled in, and the pipe itself is also serves as the water container. It contains, if it's 6 meters long, it contains 32 liters of water. And if you only need 130 ml per child, you can calculate how many children can wash hands before you have to refill it. But it also has a possibility. You can see that in the first slide up there with a little part, yes, there, where you can attach a pipe. Okay, next slide. Yes. Okay, back to, we spoke about infrastructure and the respective hand-washing intervention. Now I will briefly speak about the school-based management aspects and the different stakeholders. Next slide, please. Yeah, so what does it need to happen or to have school group hand-washing happening? So we spoke about technical aspects, now we will speak about institutional aspects. Next slide, please. And you can see that it's all about the school principal, and that WASH in schools he is a key actor, and you need to strengthen the school-based management capacities of the school principal to really make it happen. And that means his leadership, the motivation to guide implementation, mobilize and allocate resources, integrate WASH into the improvement plan, keep the school ground clean, and so on. So with respect to time, I will shorten it here. You need a lot on the management aspect. It will never work, never ever, if just hand-washing facilities are dropped at the school and there's even soap left there. That will never ever work. It's quite an effort, and it has to be really integrated into the entire school plan and into the entire routine of a school. And the most important part we've seen is that it needs really regular monitoring, and the monitoring is helping to keep it going and to look for quality. Next slide. I will just give you a very brief example. There was in program in Lao PDR, the World Food Program is conducting a feeding program, and had always a problem with proper hand washing before. And in that case, we could see all at baseline. It was also accompanied by a study. The study will be published. But just briefly, at baseline, none of the schools had conducted organized group hand washing, but children just had the habit of wetting their hands prior to eating. So that habit was already there. After the program, after schools and the interventions just receiving hand-washing facilities and being very clear with the school head and the community how to integrate and how to really make use of the facilities. After the program implementation, it was in 10 schools. All the 10 schools practiced group hand-washing, except for days where the feeding was not done. It was really totally linked to the feeding and was part of this feeding routine. So it's a question of developing routines on very certain aspects which are already existing. So the important is functioning facilities and the building of routine. Next slide. What was there nice to observe was that it took roughly 15 minutes for all kids to wash their hands. There was only one facility available for 90 kids. And this is the amount of water they used. And a regular other water, a conventional hand washing facility would roughly need the 10-fold amount of water. Next slide. Yeah, the take-home message is really regular hand washing with soap needs functioning facilities and availability of supply. Facilities need to allow for all children to do hand washing with soap in short time, and only availability of group hand washing will allow for all children to develop hand washing habits in school. So for habit formation, you would really need that. And this is where my presentation ends. Next slide. You can still see all materials are available on the Fit for School website. There's a lot of material which can be downloaded, from films over also very detailed information on this wash-a-lot, even the construction plans and how to build it, even with videos. So I think you can get a lot of information there. Thank you for your attention.
Thanks so much, Bella. Eric, yes. Eric, if you wanted to go ahead and start sharing yours, you're welcome to. I've stopped sharing, so hopefully it should release to you. Thank you. Thank you again.
Thanks, Bella. I certainly want to change up my entire presentation and focus on hand washing now. However, what I'll do is I'll give you a really high level view of what Splash, well, where we work, why we work there, what we do, and then a pretty big project that we currently have around washing schools in 2 big cities. Let me make sure controls are working. Great. So everybody's aware of the massive deluge of people from the countryside into the city. But the numbers are pretty staggering at this point, right? Every week, 3 million people move into a city, and it's becoming quite untenable. Right? By 2050, 75% of the global population will live in a city, and as soon as 2030, 1/4 of the world will live in a slum or a low-resource neighborhood. These have created these oceans of poverty that contain these small islands of wealth, and fortunately, in each and every one, that center with the red roof in the middle, each one of these has this incredible conduit to the larger community. Each one of these poor and slum neighborhoods has one of these buildings in it. It's a public school, traditionally a government school, sometimes community, but there's always a school nestled in the greatest pockets of poverty. Some of them are really small. Some of the schools we work in are 20 to 50 kids. Some are massive. We've got some schools in Ethiopia that we're going to be working with that will have 8,000 kids in a single daily cycle. And all of them are so ripe with so much human intellect. Kids as goofy, as naughty, as wonderful, and as full of potential as my own, but really stuck in impoverished conditions. So this is a shot in Nepal where we launched our biggest school program, our initial flagship school program. And we went around the city to all 500 plus schools and tested the water quality at each and every one. And third-party water quality labs, third-party enumerators, and we came back with 70% of the school water in Kathmandu came up contaminated with E. coli. Right, 1% should shut a city down. 70%. Right, most of the schools, the water isn't sufficient in volume, or it's not drinkable at all, and yet oftentimes it's the single daily source that most kids have. Hand washing solutions, Bella showed a few. This picture was taken at a school for 2,000 kids. Right, you can see the complexity there when this is considered innovation. And I greatly appreciate Bella's photos. More often than not, whenever I see brick, mortar, and tile, they actually end up looking more like this. This station is in Ethiopia, constructed at a model school by the government, and this station is less than 6 months old. On this station in Addis, it's 5 years old, but it turned into basically a locker, a storage warehouse area after its first year of operation when the plumbing itself failed and the taps were stolen. And then toilets, we all know the dynamics there of getting functional doors, getting lighting, ventilation, adequate cleaning. This is a school of 2,000. This is a picture I took last 2 weeks ago in Ethiopia. The school had not had water in 6 months. The toilets hadn't been clean in 3, and at a school of nearly 3,000 kids, almost everyone was openly defecating. Or this in India, which is considered a highlight school by the local government, where they told us again and again that there was hand washing integrated into the toilet stalls themselves. So on our end, we've got a lot to deal with. We work in cities and we try and do 100% coverage of all the public schools in those cities. So sometimes that's as few as 400 schools, sometimes that's as many as 2,000. But in all of them, the conditions I just showed you were average conditions. They weren't extremely bad and they weren't the overachieving schools. Those were the norm. So at the base level of everything we do starts with safe water. And we do that by accessing or leveraging what already exists. There's already filtration the world over in almost every country. There exist economies around filtration and around filtration acumen and expertise. And so we work with the private sector to install the same filtration systems that you'd find in the back end of any Starbucks or McDonald's or fast food chain or coffee shop or high-end hotel. We get them at cost. We get local technicians to actually install the equipment and to service it over the long term, and for the government and the schools to pay for that same service. We work with water and sewage authorities to ensure that there is appropriate volume going into the schools. What we find is that many of the urban schools that we're working in were built in the 1970s and 80s, and the plumbing lines put into those same schools were built for much smaller populations. So working with the sewage authorities, we can actually increase from, say, a 2 to 3 inch line in up to a 6 to 10, ensuring that there's much greater volume. However, in places like Addis Ababa, which is where one of our biggest country programs are, we have found that the water is so scarce that we have to build abundant storage at each site. So our average right now is, or our standard is 27 liters of water per day per child, and that covers toilet use, hand washing, drinking, food preparation, etc. And when you think of 27 liters times, say, a school, like I mentioned earlier, of 8,000 kids in a city where the schools only get water 1 to 2 times per week, we have to overbuild on storage. Once we have adequate water, we have to segregate for activities. So Bella showed a lot of hand washing stations, but we want to always make sure that we are segregating hand washing from drinking. Those activities have to be bifurcated. You cannot see a kid hand washing out of a drinking station or drinking out of a hand washing. It negates each purpose. You'll note in here that we have color bifurcated the stations that we design and build intentionally. I saw a question in the chat box about nudges, and I'm happy to chat about that. And here we go, behavioral nudges. So we ensure that orange is always the color of hand washing, blue is always the color of drinking. Integrating small things, small, very cheap things like these mirrors, see a double-digit % increase in users, right? Kids are vain. They oftentimes don't have mirrors at home, and if you get kids near the station, they'll wash their hands. But creating that gravitational orbit is so imperative. And what we found is the simple addition of this mirror will increase users. And the #1 increase are teen boys. We see a much greater increase with the mirrors from boys 10 to 16. It's pretty comical. Bella mentioned soap availability. If you don't have soap, all this is for naught. You can build a $200, a $2,000 station, but if you do not have soap available at the school, it's all for naught. We ensure that parents are donating each bar of soap per each child, and in aggregate, it's enough for the entire calendar year, and the administration and the janitors themselves are responsible for distribution. Here's just a little bit about what we've done with our stations. We've spent a great deal of time across many countries and hundreds of schools, really trying to develop the stations that would, as I mentioned earlier, create that gravitational orbit so kids get closer and so usage is really high. And in this instance, we could not find adequate product on the local market or even on the global market. So unlike the filtration where we really felt that we could leverage what already exists, in this case, we actually had to manufacture our own. So now we are manufacturing these primarily in India and China for distribution into our larger programs to ensure that we can do this cost effectively, that quality control is always inherent in the product, and that we have better control over the designs at large. Then we're doing similar work with the government right now in Ethiopia to ensure that all the toilets that we are creating in concert with them integrate a lot of that human-centered design thinking as well. You will note that the stations, for us, the most important time to use those hand washing stations is directly after toilet use, and the further you make those stations away from the toilets, the less likely you're going to see adoption of the same. So in every toilet block in which we build, we are integrating those mirrors, we are integrating those stations. And as I mentioned, we've done a lot of human-centered design to ensure that these toilets are functional and primarily functional for girls. And that was the hardware side. That's making sure that the school is safe enough to have an education. And then the software side of this, making sure the school can educate kids on how to be safe is just as important, if not even more so. If you look at our primary cost drivers, it is not on the software side, but if you look at the long-term sustainability, functionality, durability, etc., the software component is the most important piece. You cannot do that without the hardware, so that's the critical component. So we spent a great deal of time focusing on janitors, actually a great deal, making sure that they have an adequate place to store their materials, that they actually have the proper cleaning materials, that they actually have the proper training. And then we spend an equally great amount of time ensuring that we are honoring them in front of the school, that their contributions to the schools aren't left unnoticed, that the school students, the administration, and the parents are really honoring their service, and that we're trying to build out this larger community of practitioners around the janitors, around their training, around just developing their larger community as a whole, and ensuring that we are continually refreshing their training annually. Separate from that, just as important is the creation of the student clubs. We really want to make sure that the messaging at large at each school that Splash works at, that the primary voice of that are the students, that is supported by materials that we help design, but that the students ultimately approve, and that they really are, as I said, the voice of the program in the school. They're the ones that are messaging the hygiene, the menstrual health, the body cleanliness, on and on, that they're messaging to their peers. That they are the ones that are walking the school grounds. This little boy was kicking the toilet door, and the student club was the first there to ensure that didn't continue. Or this little girl in Kolkata in a midday meal, she had pulled this little boy out of line because he was the only person who did not wash his hands before he grabbed a tray. She walked him all the way back, and there he had to wash his hands in front of her before he could grab a tray again. I'm really trying to empower the kids in these clubs to be the much broader voice to community as well, even on really tough topics. So these are secondary school students coming into a primary school, primarily of boys, to talk about menstruation, to talk about the physiology of it, the biology of it, the importance of it. They're very tough topics, and we want to ensure that these kids are adequately trained and properly tooled up to be able to have those conversations. Similar to the hygiene and child focus groups that we create, we also ensure that for ages 10 and above, that we're creating menstrual health groups at each and every school. And ensuring that we're involving parents too, and those are tough conversations at times, but imperative that parents are involved in these much larger conversations. Lastly, that teachers are constantly reiterating the same messaging at large, the same messaging from the student clubs, the same messaging that the janitors hear, the same messages that the administration really tries to mandate and enforce, that teachers are taking part in those conversations as well. We're trying to ensure that every year we're bringing together all the focal teachers that we train together so that they can share their expertise, they can share their best practices, they can share the innovation that's happening at their own schools and learn from one another. And again, to build out this much larger community of practitioners and champions. And then lastly, that every year we're trying to involve the PTA, the larger community, all the students, all the administration, teachers, and janitors to do refresher courses, to do song, dance, play, and really try and energize or re-energize the WASH messaging at large. Now, I'm gonna unshare my screen for a second so I can jump into the meat of what I wanted to share with you. Just give me 1 second, please. There we go. So all that was basically what happens at one school. All the hardware activities, all the software deployment. We take about 3 years at every single school. The first year of the major capital costs and the construction projects and some of the early work around software, then an additional 2 years for that reinforcement, and then we monitor for an additional 2 years post that. So really, every school sees about 5 years of engagement from Splash. Now this is where it becomes complex. In a place like Kolkata, we are going to, in the next 5 years, be working across 1,479 schools, right, for almost 400,000 kids. And this last year, we were in 72 schools. You know, it wasn't a huge lift. In year 2, it's going to be 126. By the time you get to year 4, we're going to be in 550 schools annually. And let me just show you to one of my earlier points. If you slice down in any component of the city, so say this, low resource neighborhoods, schools are nestled in every single pocket of the city. So our larger theory of change is if you can get to 100% coverage of these schools, if the kids from kindergarten all the way through secondary are experiencing the same high quality of WASH messaging, WASH infrastructure, WASH activities, the same reinforcement of the messaging around the same, that you can alter the trajectory of their lives, but it needs to be 100%. It can't just be a pilot in one small neighborhood. It has to be city coverage. In Addis, it's far fewer schools, nearly 400, but far more kids, more than 500,000. This project is slated to be done by 2022, but in both instances, you know, it's a pretty slow growth in year 1. Only 50 schools last year. This year we'll be in 150, and next year, similarly, about 130. Some of these schools are big and unwieldy, right? Here's a school of 6,000. Some are small. Here's a school of 670. Every single one needs a right-sized solution. And to be able to standardize that, work in concert, direct concert with the government, is a really complex endeavor. And then doing that across an entire city. Obviously, you all know or can imagine that complexity. So our goal initially is to be able to get to 100% coverage of both of these cities. And in both, our push is for the government to fund 50% of all those capital costs up front. And we are pushing to have that from city level funding, so that's tax revenue, rather than ministerial funding, which is often loans. In City 1, which is Addis and Kolkata, we'd like to see that at 50%. By 2022, we'd like to be pushing forward in secondary cities with the government funding 75% of all those costs. And then by 2023, 2024, we'd like to be going out into a tertiary city with the government paying in excess of 90%. And in both of those instances, we would like Splash Ethiopia and Splash India to have become autonomous entities where they are no longer reliant on the international head office for their funding, that everything is actually borne out locally. So that's where we are at. Each and every school involves that level of involvement, and then doing this at scale is going to be quite an endeavor. So I look forward to any questions you might have.
Fantastic and great on timing. Thank you, Eric. So I just want to kind of thank both our speakers for your presentations. Now I'm going to direct my attention to the chat box to take a few questions. I see there were a number of questions, and I see some might have been answered, but I'm just going to go from top to bottom, kind of at fast speed, so that we could try to ensure that we address each one. So the first question comes from Mohini, and it's directed towards Bella. Have any studies been done on water and electricity consumption with group hand washing facilities with piped water supply, not storage containers, that show that it's economical in such a setting if implemented correctly? What measures have GIZ and FFS instituted to prevent vandalism of group hand washing facilities? Bella, do you want to take that one? Oh, did we lose her? Hang on. Bella? Oh no, I think we might have lost Bella. Okay, so Mohini, I will direct her question and I'll email her and create a question and answer page for that, if you can just hold. A next question I think also was directed towards her from Tirth from Nepal. I have one query about water flow from Washalat. Again, until Bella comes back on. I will just hold those questions. Sorry.
Salome?
Yes.
Yeah, sorry, just to say that Frederick, Bella's colleague, is on the line. If
Is he?
yes, if Frederick, if you wanted to answer any of the questions, please feel free to do so, or we'll wait for Bella.
Frederick. Okay, I'm just gonna push past so we get questions to Eric. And Frederick, if you want to just flag and unmute yourself. So to Eric, question was, do you implement any nudges in the group hand washing, which you did answer, or do you see it as a nudge itself? How do schools manage their soap supplies? So Eric?
I don't know if that was to me, but for managing of soap supplies, as I mentioned earlier, we have soap drives every year. So every family is responsible for donating 1 bar of soap. And in aggregate, that's enough for the entire calendar year. And then that is distributed, that's overseen by the administration, but then distributed by the janitors daily. So there's a soap log of in and out, and that compensates for or accommodates for stolen bars of soap, which happen every day. But what they'll do, they'll take the large brick, they'll cut it into multiple pieces, they'll distribute it, they'll log where they went, how much went out, and then at the end of the day, they'll track how much came back in.
Fantastic. There's a follow-up question. It's general. It's asking about how do they manage supplies. I know that's specific to the soap, and is it through government or private sector? Just for the model of your program, could you speak to the supplies?
Sorry, I'm trying to find the chat itself. I don't know which supplies. I mean, if it's soap supplies, that's the distribution scheme for us. It's donation from parents. That's one of the fastest ways to a much bigger and larger conversation with the parents is around the donation of the soap. And then from there, we actually have an in to discuss the why that's so important, why kids need to be washing their hands daily.
Okay, so Ilango, if you wanted to, hopefully that does address your question, and it was about soap. If it wasn't, if you could just unmute yourself or come back into the chat box to further explain your question. Oh,
yeah, if it had to do with broader supplies like the products, we try in India, 100% of what we use is actually sourced from country. In Ethiopia, we just don't have that capacity as it relates to filtration. Almost everything else is made in Ethiopia. Or purchased in Ethiopia, but the systems and the water stations themselves just can't be at this time.
At this time, yeah. So Eric, a question directed to you is, how do you manage data on the wash conditions for all schools in the city? Is it locally managed by the school and local government? And what are the tech solutions? Do you have any tech solutions built into the monitoring system?
Yeah, so what we found in both cities that I discussed, Kolkata and Addis, that the government has actually solicited us for data on the schools, which is illustrative. I mean, there's a lot of kids under their care. A lot of these buildings were built decades ago. Some of them, they don't even know where they're at, quite literally. So what we'll do is we'll do a full citywide survey, which will get all the data from all the schools, all the government related offices. Then we'll go out and actually look at all of the schools through third-party enumerators, make sure that they are taking a standardized list of questions that we have about the conditions of the school, about the functionality of the toilets, of the hand washing stations, of the drinking services, on and on. We'll get that in aggregate, and that was the view that I just showed. And then prior to implementation of any work, 6 months prior, we will actually go in and do a real deep dive, a structural assessment of the toilets themselves, engineering assessments, and really understand what the depth of the intervention is going to be at that respective school. And that those can be 30 to 50 schools at a time. So we've got a lot of really rich data to be able to provide the government of the before conditions and the after. And then, as I showed you, we're pulling data from Salesforce and other storehouses of data from us to be able to visualize through that system I just showed you via Tableau.
Wonderful. And this question comes from Mohini, who is my colleague from Save the Children, and would like to link up with you to discuss that technology, if that's okay. Okay, great.
Hi, I just wanted to mention that Bella is now online via Maya account. So she would be able to she had some technical issues.
Via the phone. Yeah, I can only be the phone now.
Hi, Bella. Thank you, Frederick. So quick question was, do you have any studies that have been done on water and electricity consumption with group hand washing facilities using piped water supply that can show that it's economical if implemented correctly? And what measures have GIZ instituted to prevent vandalism at these hand washing facilities?
Okay. So we have no studies on the electricity consumption, but we work more with a operation and maintenance cost estimation and up to estimate the cost. So schools can measure or can calculate by themselves what they need, but we don't have the cost because it depends also what you use for hand washing consumption or what you use for hand washing facilities, which you would need. The entire aspect of operation and maintenance and the cost for washing schools, we can send the link to the app, which has taken a long time, but it's finally done now, so that can be tested by groups, so that schools can estimate the cost for washing schools by themselves, and governments can then also see how much is it within their respective area, either on city or on county or level, and see what they can afford. So that's quite important to find that out. But there's an app available to calculate the cost.
Oh, great. I'll follow up with you for that.
And the other question was on...
It was around preventing vandalism of these facilities, these hand washing facilities.
It depends on, we have not, we've not experienced the same amount of vandalism in Asia, what I hear from areas in the Middle East or even in Europe. But it's important that so far as the facilities are quite near to the school buildings, it's also less, or they're visible. Of course, so that's less. It depends on the size of schools and how much is there. The most important is to involve the parents, involve the community, and make it really part of monitoring, so that also teachers or school have a view on the facilities, and that will make a big change. As long as facilities are a place, toilets or also hand washing areas, place where nobody goes and where also no adults will ever go, it is totally prone to vandalism. But it's very important that this will be places which belong to daily school level, which will be cleaned every day and shed a light on them. I think that is of utmost importance.
Okay. A follow-up question was on the wash lot tab. According to WASH standards, the WHO says that water flow should be 5 liters per minute. And is this standard maintained in this facility or in this material?
Yeah, because you don't let it run you only let it run for the moment where you press it. So I think we haven't let that run for a minute to test that, but it's something you can model by the way how you work. You have these feeders which are being used at outlets, other ones which have to be sort of manipulated in order to determine the water flow. So there is a spiral in, and that will determine also the water flow. So that's something which can be adjusted according to the way how you work on this feeder. But it's also important that you don't have it's also always a question, a balance between stronger water flow and also the water consumption. So in areas where you have very little water and water is an issue, it's important to just use very little water and see that you perhaps it takes a bit that your hands are really washed off, but you do not have the same water flow as you have it from a tap where you just open the tap. But you can determine it by working on the outlet.
Great, thank you. And I see that Frederick actually also addressed this question further below. Forgive me. So I think
in the he knows the details because he's the one who worked on it.
Yeah, he did. So I'm just gonna back up again, come back out. One of the questions directed at Eric was around human-centered design. How did you implement the human-centered design approach and infrastructure in each location? And was it a series of meetings, discussions with schools officials, janitors, local engineers, etc.? How did you go about that?
What I could do, just for the preservance of time, I can send our human-centered design kind of framework for Splash. We've stolen it from the London School of Hygiene and Tropical Medicine, tweaked it to our own needs. But really, it's you know, the lit review, the formative research, then the investigatory period, and then it's the product design, getting some things out into the wild to see what actually works, what doesn't. And just a multiple iterative process therein. The stations are designed off about 10 years of work, really honed into to do it in plastics so we could actually scale up that product and observe that quality control. As I said, we've been doing things out of fiberglass and other materials because, again, we found that brick, mortar, and tile just does not work. There's these big, giant, lumbering things that are built and they can never actually move with the school grounds. They're always in one location rather than in the multiple locations that they need to be, which are closest to the toilets, closest to the place where kids are going to be consuming food, on and on. So we did end up building those smaller versions of the stations that I showed you, and then those are populated all around the school. But yeah, I'm happy to share the HCD work that we do, or just the framework in general.
Thank you. That'd be really great. Sorry, there's so many great questions. I'll just do this as the last question, and this is directed to Eric. Are you subsidizing the wash supplies and the operation and maintenance costs of the school? I know that you have briefly were explaining different percentages of how you go about that, but if you could explain a bit further.
Yeah, in the first two cities, the goal again is that the government's paying 50% of all the in-country costs. So yes, we are definitely subsidizing some of the work philanthropically, but the goal again is that you're bringing down the cost, you're showing the proof of cost efficiency, of health impact, of durability, of true scale, so that by the time that you are moving into city 2, the government is paying more and the lion's share at that point, and so that by the time you're going into city 3, they're paying the vast majority of costs. I've not seen a program that you can do where the government's paying 100% from day one, which is
And do you have any tools for O&M cost budgeting that you use, or would you
we work primarily with the school, like the municipal level officials, that then they budget it for their own respective state, and then we work downwards with the actual schools themselves. But we do life cycle costing to show what a 10-year run actually looks like for each of the schools, so they understand that these costs go down, but then they normalize after year 3, and this is what they should be budgeting over and over. So yeah, we do work with the individual schools, but primarily we're working mostly with the district level officials.
Got it. Perfect. Thank you so much. I know this was a lot of these are a lot of questions. It's just great. I know that we're out of time. I will copy the chat box so that we can follow up if there are any other questions that weren't addressed. I wanted to take a quick moment to thank all of our participants and our speakers today. It was a really great discussion. Just a heads up. Just a heads up. I'm going to take a quick moment to announce that in our next webinar, which will be Tuesday, April 14th, we're going to commemorate World Health Day and discuss Save the Children's response to the COVID-19 pandemic. The invitation will be forthcoming. And if you have any trouble with the invitation, or if you know colleagues, just please send that to me. You can send it to me at fresh@savechildren.org. As always, these recordings will be posted on our 3 sites: Save the Children's Resource Center, Fresh Partnership sites, and the UNESCO HIV and Health Education Clearinghouse site. Thank you all and have a wonderful day.
Thanks.